I'm Joseph Halpert, editor-in-chief of the American Journal of Medicine, and I'm again with you this month to point out what I think is an interesting article in this month's issue. It comes from the NYU Medical School in Manhattan, Siddiqui et al. They explored a very large database of patients who went to non-cardiac surgery. And they then evaluated the frailty scores. That is, of course, muscle wasting and weakness and general inability to do daily activities, and compared the outcomes of the surgery in the people who had frailty versus the people who were not frail. And of course, these are all elderly individuals. It's no surprise that the patients with frailty had many more complications and a higher mortality. I've seen that observation myself. Of course, we see, just as I'm sure just about everybody looking here sees, older people falling with hip fractures, and then going in to have, of course, the hip repaired, because otherwise they're not going to walk ever again. And you can just tell when you see the patients who are frail. Sometimes you can just tell it by looking at them, but there's a very simple index that can be calculated, which is what Siddiqui et al. Did. And it just prepares you, and of course needs to prepare the patient and the family that this has a higher risk of complications and of death, just because the patients are so weak and frail. Interestingly, we published an article some years ago that pointed out also frailty is associated with high inflammation in the patient. And that's probably what's damaging the muscle, and the liver and the heart and so forth. Well, in any case, it's a pleasure having you read the American Journal of Medicine. Please stay in touch with us through our many social media on our website. Looking forward to talking with you again next month.